What are the criteria that we're looking at when evaluating a case to determine if this is somebody we can help?
Sure, good question. So question number one is, did you take the drug? Did you take one of the 5 tenofovir-based drugs? Viri, Truvada, Atripla, Stribild, Complera. Did you take one of those 5? So that's the first thing. The second thing is, are you off the drug now? Most of our clients are off the TDF-based drugs and are now on the TAF drugs. They should have been switched at the time that the TAF drugs came out. Now that's a decision that each physician makes, and it's not a decision, it's not a recommendation that we make, but this is what we're seeing, that most of our clients are being switched off the TDF drugs in favor of the TAF drugs. We look at how long they were on the drug and make sure that they were on it for a sufficient period of time. We look at their pre-existing history, making sure that they're not bringing a host of medical problems that are related to
So
bones
if they
and
had
kidneys.
a history of kidney damage before this, then it would be more difficult to bring a claim.
Absolutely, and that's one of the things that we look at. And then we look at, did you suffer one of the signature injuries that we're looking for? And again, that's a kidney injury, a bone injury, or tooth loss.
Are there other medications that people could have been on, non-tenofovir-based drugs, that play into our evaluation of a case?
Right, there are other antiviral agents like AZT, you may have heard of, one of the first antiviral drugs that people with HIV were on, and there was a whole cocktail of AZT and other drugs that people living with HIV went on to help expand their life expectancy. So again, we try to learn the entire patient's history of both what their medical conditions were and what drugs they were on, so our physicians can help us make a decision or come to a conclusion as to whether or not the tenofovir-based drug played a role in the client's injury.
Does it matter if a person was taking TDF as HIV medication versus taking it for PrEP?
So that's a really good question. Let's make sure our audience knows what we mean by PrEP. Truvada, one of the 5 tenofovir-based drugs, is used for PrEP, and PrEP is spelled capital P, small r, capital E, capital P, and PrEP is prescribed by physicians for people who do not have HIV. In fact, they are HIV negative, but they may have a partner who's HIV positive or otherwise engage in sexual activity that would put them at risk for developing HIV. So when a patient is on Truvada for PrEP, they shouldn't have any history of kidney disease or bone disease, and they're really being exposed to a tremendous potential for harm without knowledge that there was a safer drug that they could have taken.